This is Modern Dental Assisting, Chapter 34, Dental Hand Instruments lecture. We're going to review a little bit that was talked about in a previous lecture and then finish out this chapter in this recorded lecture. We spoke about the wide variety of dental instruments that are used in dentistry and then also the dental supply companies that manufacture these instruments. When we talk about identifying hand instruments, there are a few different ways to identify. There are assigned numbers from the manufacturer that are universal. And then sometimes the dentist will have names that they've picked up along the way. I'm sure when you're in class, your instructors will tell you names for instruments that they've heard in the past. And it's really to your advantage to learn both or at least have an idea of both. So when you get in the field, you have a good idea of the instruments that your doctor and provider are looking for. Remember that when we're setting up instruments on a tray, we want to set them in order of use from right to left. And we're expected to be able to pass these instruments to the provider without having them ever having to take their eyes off of the tooth that they're working on. Moving forward with talking about instrument design, hand instruments have three specific parts. So we have our handle. This is the portion of the instrument where the operator is going to grasp. The shank is the part of the instrument that connects the handle to the working end. And then the working end is going to have a specific function. So we talk a little bit about ergonomics with the handle. You will see when you get out and start talking to reps and providers that some may like a wider or lighter type handle to help with hand fatigue. In this chapter, we also talk about the instrument formula. So Black designed a formula that describes the angulations and dimensions of the working end of a hand instrument. Hand cutting and scaling instruments have three sets of numbers that identify the width of the blade, the length of the blade, and then also the angle. We talk a little bit about instrument classification. So four separate classifications. We have our exam instruments, our manual cutting instruments, restorative instruments, and then accessory. So when you're in the field, it's not only important to learn the names and numbers and functions of instruments, but also what classification they fall into. Procedure tray is set from left to right based on how instruments are transferred and used throughout the dental procedure. The clinical assistant uses the left hand when transferring instruments. Most frequently used instruments should be placed closer to the dentist for ready availability. With our examination instruments, these are most utilized, and these can be in a wide range of procedures like checking specific problems, so our limited oral exams or exams in general, um, and then also elevating a restored tooth. We talk about our basic setup in this chapter. So with every procedure and every tray setup, you're going to see your basic setup. This consists of your mouth mirror, your explorer, and your cotton forceps or pliers. Remember, your mouth mirror is used to retract, to light up the oral cavity, and then also used for indirect vision. Our explorer is going to be used to detect caries or any abnormalities. And then we use our cotton forceps for a variety of things, but mainly to transport in and out of the oral cavity. When we're passing instruments in the procedure, we like to pass the mirror and explorer first, usually together, the first instruments that we are passing together to the operator. Our hand cutting instruments will be the next group of instruments on the tray. The dentist will have a preference as to what instruments that they want to be included. Typically, what we'll see is some type of organization for each tray setup. So maybe these instruments are sterilized and bagged together, or maybe pre-selected trays are already set up, but we will typically see our manual cutting instruments next. Then we have our restorative instruments. These are used to place, condense, and carve restorative dental materials back to reflect the normal anatomy of the tooth. These are selected for the tray setup with the dentist preference and the type of dental material selected for the procedure. So with restorative, we have amalgam versus composite. So those instruments are going to reflect. Our accessory instruments are going to be the instruments that might not always be in our tray setup, but we can pool to use just depending on the procedure. So with these instruments, we still wanna follow the procedure for proper infection control and making sure that we're sterilizing, but we might not necessarily use every instrument for every procedure. So we talked a little bit about organization and keeping our trays set up and together. So our hand instruments and related accessories, a given procedure, paired, stored, and transported together. We can use our preset cassettes or trays. This is just going to keep our instruments bagged together, sterilized together, and they'll go on the tray together. You also might see like a tub system. So we would have our instruments stored in like tubs. And then more commonly, I see out in the field is a color coding system. So there is tape that is available and also little rubber rings that you can place around the instruments. So this is a good way to take a look at your instruments and add like colors together to make your kits.